You never imagine that it will happen to you. One minute you're enjoying a quiet afternoon, perhaps sipping tea or reading a book. Then suddenly, a strange discomfort settles in your chest. Not the sudden, sharp pain you imagined, but a dull heaviness, almost like an elephant pressing down. You feel tired more than usual. Maybe your jaw aches or your back feels tight. You shrug it off. After all, you've lived a long life. You think, maybe it's just indigestion or stress. But deep down your body is sending you urgent warnings. Because in reality, these subtle signs could mean one thing. Your heart is struggling, possibly in the very first moments of a heart attack. For people over 50, recognizing the early symptoms of a heart attack is not just important, it's a matter of life and death. The truth is, heart attacks don't always announce themselves with dramatic chest clutching or sudden collapse. Research shows that up to 45% of heart attacks, especially among seniors and women, begin with mild or atypical symptoms that many dismiss or misunderstand. These can include fatigue, nausea, shortness of breath, unusual sweating, lightheadedness, or discomfort in areas such as the jaw, neck, back, or stomach. This confusing array of signs makes it dangerously easy to ignore the problem until it's too late. Imagine Mr. James, a 62-year-old retired engineer from Berlin. He woke up one morning feeling unusually tired and dizzy, but attributed it to lack of sleep. A slight pressure in his chest came and went throughout the day. He thought it was acid reflux and took an over-the-counter remedy. By evening, the discomfort intensified, and he finally called his doctor, who urged him to go to the emergency room immediately. Tests confirmed he was having a heart attack. Had Mr. James ignored the warning signs any longer, the damage could have been far worse. This story is not unique. Across the globe, countless seniors fail to recognize or act on early symptoms, leading to tragic outcomes that might have been avoided. One reason symptoms can be so subtle is the way our bodies change with age. Aging hearts may respond differently to the stress of blocked arteries or reduced blood flow. In fact, a landmark study by the National Institutes of Health found that seniors frequently experience silent or atypical heart attacks, where traditional chest pain is absent or minimal. Women, in particular, face an even greater challenge. According to the American Heart Association, women over 50 are more likely to have non-classical symptoms such as nausea, jaw pain, and shortness of breath without chest pain. These signs are often mistaken for less serious conditions like indigestion or anxiety, delaying treatment and increasing risk. Why is early recognition so critical? Because the longer your heart muscle goes without oxygen-rich blood, the greater the damage. Heart cells start to die within minutes. Immediate medical attention can open blocked arteries, restore blood flow, and preserve your heart's function. The good news is, awareness can save your life. Understanding and trusting your body's signals is the first step. If you notice any of these warning signs, unexplained fatigue, discomfort in your chest or upper body, difficulty breathing, cold sweats, or nausea, don't hesitate. Call emergency services immediately. Emergency medical treatments like aspirin, clot-busting drugs, or angioplasty are far more effective when administered quickly. According to a 2018 study in the Journal of the American College of Cardiology, patients who received treatment within the first hour of symptoms had a 40% lower risk of death compared to those treated later. Another powerful tool in your defense is regular health checkups. Conditions like high blood pressure, diabetes, high cholesterol, and obesity silently increase heart attack risk. Managing these through medication, diet, and exercise reduces the chance of a sudden event. Beyond medical factors, mental health and stress also play a crucial role. Chronic stress and depression can worsen heart health and mask symptoms. Keeping a strong social network and engaging in activities you love can boost emotional resilience, making you more alert to changes in your body. So how can you prepare yourself right now? Start by educating yourself about heart attack symptoms. Tailored to your age and gender, talk openly with your doctor about your risks and what warning signs to watch for. Have emergency numbers saved on your phone and nearby. Keep aspirin accessible if your doctor recommends it. And importantly, never ignore your intuition. If you feel something is wrong, act immediately. The first step to survival often begins with simply listening to your body. This is why we created the Elderly Health Path channel, to empower you with knowledge and hope. If you find this information helpful, please subscribe to stay connected with our community, focused on heart health and senior well-being. Together, we can build a future where no senior suffers in silence from preventable heart attacks. Remember, your heart has been working tirelessly for decades. It sends messages in many forms, some gentle, some urgent. Your ability to recognize these early warnings could be the difference between life and loss. Don't wait for the classic Hollywood heart attack. Look for the subtle signs. Trust yourself. Reach out. Because every heartbeat matters, especially after 50. Imagine this. You're sitting quietly at home, maybe reading the newspaper or watching your favorite show. Suddenly the discomfort you've been feeling intensifies. Your chest tightens, your breath shortens, and panic begins to creep in. Your mind races. You know these could be signs of a heart attack. But there's one big challenge. You're alone. This moment is critical. The decisions you make in the next few minutes could mean the difference between life and death. When a heart attack strikes, every second counts. The sooner professional help arrives, the better your chances of survival and minimizing permanent heart damage. Calling emergency services immediately is not just important, it's essential. Heart attacks happen when blood flow to a part of the heart muscle is blocked, usually by a clot. Without oxygen-rich blood, heart cells begin to die within minutes. Emergency medical technicians, EMTs, are trained to provide life-saving interventions like oxygen therapy, medications, and defibrillation to restore heart function. The faster they arrive, the better the outcome. But what if you're weak, dizzy, or unable to reach your phone easily? This is a situation many seniors face, especially those living alone. This is why preparation is just as vital as reaction. A 2021 study published in the Journal of Emergency Medicine highlighted that seniors who have quick access to emergency communication devices, such as medical alert bracelets, wearable alarms, or smartphones with emergency apps, were significantly more likely to get help within the golden hour of a heart attack. The golden hour refers to the first 60 minutes after symptoms begin, which is crucial for survival and recovery. If you haven't already, consider investing in one of these devices. They can be as simple as a button you press to call for help or more advanced systems that automatically detect falls or irregular heartbeats. Many modern smartwatches now come with emergency SOS features and heart monitors built in, alerting contacts or services even if you can't speak. When you call emergency services, clarity is key. Tell the operator you believe you're experiencing a heart attack or chest pain. Stay on the line and follow their instructions carefully. The operator may guide you through steps like taking aspirin or preparing for CPR if necessary. Sometimes, seniors hesitate to call for help, fearing they might bother the emergency system or worrying about hospital costs. But it's important to remember, emergency responders are there to save lives, not judge. Delaying a call, even by a few minutes, can result in more severe heart damage or fatality. Studies show that many seniors wait too long before seeking help, increasing their risk dramatically. If you're too weak to reach the phone, shout or make noise if possible to attract attention. If you live near neighbors, try to alert them early. Some communities have programs where neighbors check in regularly on seniors living alone. Consider enrolling if available. While waiting for help to arrive, try to stay calm and rest in a comfortable position, usually sitting upright to reduce the strain on your heart. Avoid any unnecessary movements or exertion. If you have aspirin and no allergy, chew 1 tablet, slowly. This can help thin the blood and improve blood flow to the heart. Keep your phone nearby and fully charged every day. Also have important information ready. Your name, age, any medical conditions, medications you're taking, allergies, and emergency contacts. This information helps emergency responders provide the best care quickly. Remember the story of Mr. David, a 70-year-old living alone in Sydney, Australia. One afternoon he felt sudden chest tightness, but was unsure if it was serious. Fortunately, he wore a smartwatch with an emergency SOS feature. When he became too weak to reach his phone, the watch automatically sent an alert to his son and local emergency services. Paramedics arrived within minutes and David received timely treatment that saved his life. This example highlights how technology, combined with awareness, can be a powerful lifeline. Planning ahead can also include informing family or neighbors about your health condition and emergency plan. Let them know the signs you watch for and how to help if they hear unusual noises or haven't heard from you in a while. Regular check-in calls or visits can be comforting and life-saving. If you drive yourself to the hospital during symptoms, be very careful. It's safer to call an ambulance because EMTs can start treatment immediately and monitor your condition on the way. Driving while experiencing a heart attack is risky for both you and others on the road. It's normal to feel scared in these moments. Anxiety can worsen chest pain and breathing difficulties. Try to focus on breathing slowly and deeply. Remind yourself that help is on the way and that you're taking the right steps to survive. The bottom line is this: immediate action saves lives. Emergency services are equipped to handle heart attacks swiftly and effectively. The time from calling 911 or your local emergency number to receiving hospital care is critical. According to the American Heart Association, reducing the delay between symptom onset and treatment can lower mortality rates by up to 50%. So, if you are over 50 and live alone, don't wait or hesitate. Prepare your phone and emergency devices, know your medical history, and never hesitate to call for help. This knowledge and readiness can turn a frightening moment into a survival story. If you found this video helpful and want to learn more ways to protect your health as you age, please subscribe to Elderly Health Path. We share practical advice, inspiring stories, and the latest medical insights to keep you and your loved ones safe and well. Your heart is precious. Every second counts. Being prepared to get help immediately when a heart attack strikes alone after 50 could be your greatest lifesaver. Imagine you're alone at home, feeling a sudden tightness or pressure in your chest. You might feel anxious, scared, maybe even uncertain about what's happening. You know something isn't right. Could this be a heart attack? In those critical moments, every single decision counts. One small action you can take that might dramatically improve your chances of survival is often overlooked. Taking aspirin immediately. Aspirin is one of the most widely available and affordable medicines in the world, yet many people don't realize just how powerful it can be in the event of a heart attack, especially when you're alone. It's not just a pain reliever. Aspirin plays a vital role in preventing further damage to your heart by stopping blood clots from growing and blocking your arteries. When a heart attack occurs, it's usually because one or more arteries that supply blood to the heart muscle are suddenly blocked by a clot. This clot forms when plaque inside the artery ruptures, triggering the body's natural clotting mechanism. While this is normally protective, in the heart it can cut off the blood flow completely, starving heart tissue of oxygen. This is what causes that crushing chest pain and the damage to your heart muscle. Here's where aspirin comes in. Aspirin works by blocking a substance in your blood called thromboxane. This chemical causes platelets, the tiny cells that help your blood clot, to stick together and form clots. By reducing the ability of platelets to clump, aspirin slows down the clotting process, preventing the clot from getting bigger. This gives your heart muscle a better chance to receive blood flow, reducing the severity of the heart attack and increasing your chances of survival. Medical experts around the world agree on the benefits of aspirin in heart attacks. The American Heart Association recommends that if someone suspects they are having a heart attack, and if they're not allergic or have been told to avoid aspirin, they should chew and swallow a standard dose of aspirin, usually 325 milliliters, as soon as possible. Chewing is important because it helps the aspirin enter the bloodstream faster than swallowing whole pills. Several landmark studies have shown the life-saving effects of aspirin. In fact, the ISIS-2 trial, a massive international study conducted in the 1980s, demonstrated that taking aspirin during a heart attack reduced the risk of death by about 23%. That's nearly 1 in 4 lives saved. More recent studies continue to affirm aspirin's role in emergency cardiac care. But what if you're alone and confused or scared in that moment? It's vital to prepare in advance. Keep aspirin tablets within easy reach, maybe in your medicine cabinet, on your nightstand, or near your phone. Discuss with your doctor whether aspirin is right for you, especially if you take blood thinners or have stomach issues, because aspirin isn't suitable for everyone. Let's consider the story of Mrs. Linda, a 65-year-old grandmother from London. One afternoon, she felt sudden discomfort in her chest but wasn't sure what to do. Remembering advice from a health seminar, she immediately grabbed an aspirin from her kitchen and chewed it slowly while calling emergency services. Paramedics arrived quickly, and she received treatment that minimized the damage to her heart. Today, Linda shares her story to remind others how a simple aspirin saved her life. It's important to note that aspirin is not a replacement for emergency medical care. It's a first aid step to slow the progression of a heart attack while you wait for professionals. Calling emergency services remains the absolute priority. Also, some people mistakenly believe that taking aspirin can prevent all heart attacks, but aspirin is not a cure or a substitute for a healthy lifestyle and regular medical care. It is a critical tool during an emergency. If you're unsure about aspirin's role or whether you should keep it at home, talk to your doctor. They can provide personalized advice based on your health history. For some, daily low-dose aspirin is prescribed to reduce the risk of heart attack and stroke, but this should never be started or stopped without medical guidance. In summary, aspirin acts as a shield in the crucial moments of a heart attack, preventing the blood clot from worsening, giving your heart precious time and improving survival chances. For seniors, who are at greater risk and often face heart attacks alone, knowing when and how to take aspirin can literally save a life. If you found this video helpful, please subscribe to Elderly Health Path for more practical advice, inspiring stories, and up-to-date medical guidance designed to protect your heart and improve your quality of life. Sharing this knowledge with your loved ones could save their lives too. Remember, in the fight against heart attacks, small actions can make the biggest difference. Keep aspirin close, act fast, and never hesitate to get help. Your heart depends on it.